People forget until they see it how bad stroke really is. And having seen it all day, every day for my career now, I can tell you it's not a good place to be.
Everybody knows about a disabling stroke because it's evident in their disability that happens afterwards. But the small nuances of things like not being able to remember things or not being able to balance your checkbook or forgetting things that you didn't have that kind of a change before, and it's nothing quantifiable on an MRI or a CAT scan, but the family is aware and the patient is aware something's different.
Yes, it's awful when any patient has a stroke, but when you're talking about 60 and 70-year-old low-risk patients having a stroke, devastating, absolutely devastating.
Each year in the US, we spend $110 billion in stroke treatment and stroke costs, both direct and indirect costs, not just the time that people spend in the neuro ICU and going to rehab, but also the time that caregivers have to miss work, the patient has to miss work, all the money lost and opportunity lost during that time period as well while they're recovering from their stroke, if they even recover at all.
Because we were part of trial, we knew that almost every basket that we retrieved had some kind of debris in it.
I think the data is clear, and I think the commercial experience is clear that cerebral embolic protection is a benefit.
This has been a game changer for quality of life.
It's a very safe device to use, so it doesn't add any comorbidity or any more complications than your usual TAVR procedure.
If you're able to have something to prevent a stroke in the first place, then why not use that? Why put someone through that risk, regardless if the risk is small, medium, or large, of having a stroke? Why not get that down to as close to zero as you can?
As a physician, our job is to look for the best way of helping our patients. If you can do whatever you can to prevent it, it makes common sense, human sense, and clinical sense.